would like to invite Linda Klein to do a brief introduction of our moderator and our panel.
We all love and adore our own doctors. Our own doctors care about us. Our friend, Dr. Valerie Montgomery Rice, cares about all of us. Not just all of us here, but everyone. If you don't know her personally, you've undoubtedly read about her incredible accomplishments. Georgia Tech to Harvard Medical School, her early career as a fertility specialist, but guided by her principled calling to help more people than just her own patients, she moved to academic medicine, where her brains and her steadfast determination led her to create programs such as the center she created for women's health research at Meharry Medical School. And her goal was to tackle diseases that disproportionately attack women of color. Her leadership skills, her organizational management talent, and expertise in health policy led her journey to the biggest impact she can make, and boy, she's done that. She never rests. I think you know that if you know her. She will not rest until the health equity crisis is solved. And as the first woman to lead a freestanding medical school, her service as president and CEO of Atlanta's own Morehouse School of Medicine is one of the many ways that she's changing the world. She creates pipeline programs to assure that there's an adequate supply of diverse physicians. She serves on corporate boards in the healthcare industry, such as United Healthcare Group or WellPath. Companies rely on her strategic thinking, among her other incredible skills, to assure that she understands the entire population's medical needs and how to meet them. She serves on nonprofit boards such as the Moffitt Cancer Center and the important HBCU Capital Financing Board. Governor Kemp has appointed her to the Georgia Commission on Women, and President Biden has appointed her to the Committee on the National Medal of Science. She's been recognized with so many awards in medicine, community service, business, and academia. I'm only going to name one today. I was privileged to be there when Valerie Montgomery Rice was selected to be a member of the Horatio Alger Association. And she was recognized for her hard work, indefatigable perseverance, and determination from humble roots in Central Georgia to be the thought leader, the team leader, the motivator of others in this quest for health equity. It didn't take her long to convince me. She shows us that there's a business case and a moral case for health equity for everyone, and that's her dream. And we, as her friends and admirers, will gladly follow her on this important mission and do all we can to help Morehouse School of Medicine and Valerie Montgomery Rice save lives and improve the quality of life for everyone. This is going to be a fabulous program, and I present Dr. Valerie Montgomery Rice, our fellow Rotarian, to lead it. Thank you.
I shall carry Linda with me wherever I go. Thank you, Linda. As our, I guess I can call them panelists, join us today. Please have a seat. Yes. I'm sure you all are aware, a little over a week ago, the World Health Organization and the United States government ended the COVID-19 health emergency. So for the first time in 3 years, we can officially go back to normal. And a great deal of the reason we can do that is because of all the hubdub over masks and social distancing, and whether any healthcare experts really knew what they were talking about. But in the end, it really came down to science, science, science. Thank goodness science prevailed, because science created the COVID-19 vaccines and enabled us to mitigate the virus. And I'm not sorry for this emphasis on science, because I've been waiting 3 years to say that science actually really does matter. Now, while we should ever be mindful of those who lost their lives, loved ones, those who endured life-changing circumstances in the pandemic, if there's one silver lining for COVID, it was vaccine development. it was actually put on steroids. And I am very happy today that we have with us on stage one of the chief architects of the COVID-19 mRNA vaccine. Now, that vaccine didn't start in 2020, like some would like to say. The development of it started 40 years ago. And I am pleased to say that we have Dr. Barney Graham with us, who led the research for the COVID-19 vaccine at the National Institutes of Health, and who I'm proud to say is now a professor at Morehouse School of Medicine and our senior advisor for global health equity. And speaking of health equity, we're also honored to have with us another chief architect, and that would be the chief architect of health equity, and that is our own David Satcher. Now, many of you all know that Dr. Satcher was not only the first African American to lead the Center for CDC, the Centers for Disease Control, he's the only person who headed the CDC and served as the Surgeon General of the United States. And of course, closest to our hearts, he's the fourth president of Morehouse School of Medicine, and he really did write the book on health equity. So join me in welcoming him. And David's going to help me make sure I keep my time, because I have lots of things I want to talk about, and I want you all to hear. But we're going to try to take you on a little journey. And taking you on this journey, it's going to be about the development of COVID-19, but it's really going to be about vaccines and preventive health care. And how do you deal with misinformation? And what did we learn, and what we will continue to learn, that's going to help us fight off the future global health emergencies. You're also going to learn and hopefully hear about how Rotarians make a difference, and how we have made a difference in the past around vaccines and the dissemination of accurate knowledge, and how we need to make a difference in the future. So it is important that I thank Dr. Satcher and Dr. Graham for joining us today. So thank you very much. And I want to get into the first question. I thought it would be insightful for the audience to really get a deeper dive into how, with all the advances of medicine and health that we've seen in our lifetimes, Dr. Satcher, how did we let a tiny virus unfortunately kill millions of people, sicken millions or more, overwhelm our healthcare systems, and shut down the world for nearly 2 years? And from that perspective, I would like to for you to give us some idea of how all of this happened from a world health perspective.
Well, let me say I'm delighted to be here, delighted to be back at the Rotary Club, and to see so many of you again. But I think when it comes to vaccines, we go way back in history in terms of the development of vaccines and seeing the impact that a vaccine can have on a disease. So I don't think the size of the virus was that much of a challenge to the virus, because the viruses that are attacking us attack us not based on their size, but based on their chemistry. And of course, I think the chemistry of the virus with which we're dealing is a chemistry that we have to become very technical about. And of course, my colleague can tell us more about what we've done. There was a large group of us that met on a regular basis to get an update as to what was going on in the laboratory. But that's not like being in the laboratory. And so we learned a lot from those that were in the laboratory, and we took risk. President Clinton took risk. President Trump took risks. because we could not have developed a vaccine that's effective without taking some risk in terms of investments, in terms of giving the vaccine earlier than usual. So we learned a lot. Barney?
So, Dr. Graham, how do you think we found ourselves in such a vulnerable state at that time in January 2020?
Well, we've been vulnerable to viruses since the beginning of time, and we're actually still very vulnerable. And I was at the NIH, I was at the Vaccine Research Center. I started there in 2020, or in 2000, about 23 years ago. And that center was founded to develop an HIV vaccine because the world had been challenged and was somewhat overwhelmed by the virus HIV since the early 80s. And that center was founded to develop an HIV vaccine. But since that center developed, we had been threatened by repeated pandemic threats. The first SARS, the avian influenza, the swine flu, chikungunya, Ebola, Zika, on and on and on. And over that period of time, even though we hadn't developed an HIV vaccine, the technologies that were generated by trying to make an HIV vaccine put us in a very different position by 2020 to respond to something that would be a new threat. And all those leading up to that had us in a position in a different way of thinking about how to be organized and respond to a new threat. And just by coincidence and some good fortune, maybe grace, we were in a position to respond to coronavirus in particular. I don't think we're really in a position to respond to other viral family threats, even still, as well as we could have done to coronavirus. So we can get into more of the details of that.
So we were prepared because we had the Vaccine Research Center. We had been working on Ebola and Zika and all of those things. So we understood some of the chemical properties of this virus because you had been working on it for a period of time. But in January of 2020, when we first started to have an indication that there was a problem, give us a quick snapshot of what happened over those next 66 days or so.
Right. Well, my children sometimes accuse me of going back to the beginning of the history of time to explain an
Just
answer.
how about
So
66
I'm going to
days?
try
How
to
about
keep it
just-
short. But it really started way before, but in 2012 and 13, our work on respiratory syncytial virus,
RSV.
okay, RSV, which everybody heard about last September, October, led to a breakthrough in understanding protein structure and how important that was for how vaccines could be designed to attract the right kind of antibodies. And I brought some of these atomic models, and if you want to see it later, we'll go into the technical details. But that breakthrough led to investigation of coronavirus over those 8 years leading up to 2020, trying to extend the observations that were made on RSV. And you may have heard some of the recent news that RSV vaccines are now being approved. That technology is, after 10 years, has led to that. But because we were ready, because we already had a plan in place with industry partners, with academic partners, with other government partners, and already knew atomic level structure of the coronavirus spike and already had evidence that certain ways of adjusting that spike could protect against lethal challenge with coronavirus, we could make an immediate decision when the sequences became available on the 10th of January.
And how did we get that sequence? You can tell the secret. How did we get that sequence?
The sequence was provided. The first 6 sequences came out and were posted on the internet on the 10th of January.
Well, how did they decide they were going to post them?
By the Chinese. the head of the China CDC, Dr. Gao, Professor Gao, was there, and I had sent him an email earlier that day asking and explaining that, we need these sequences as much as you do because this is a global threat and we have to react to it as well. And he said he was trying to get them out as soon as possible, and I don't really think it was my email that triggered that, but later that day, about 6 hours later, he finally got the sequences up. And so on Saturday, the 11th, we were able to use those to start putting together reagents we needed to build the vaccine and to get the manufacturing started. And within 65 days, we were in phase 1 trials.
I want to show this slide right here because, Dr. Graham, tell us who are those people in that laboratory picture who actually helped lead to this work that had to be done in those, 60 days to get the first shot in the arm.
Right. So the point of this slide is really to emphasize how important it is that we identify talent and launch our young people, our talented young people, into the next generation of things that need to be done. So in the upper right is Dr. Kizzmekia Corbett, who is a fellow in my lab. I've worked with her since she was in high school. She worked with me for 4 years, went to graduate school, came back to the lab in 2014. And she and Jason McClellan, who's next to her there, another young person who worked with me on RSV before moving to coronavirus, those two in particular worked over those 6 years to generate the knowledge we needed to rapidly respond to coronavirus. And between the 10th of January and the 16th of March, when that first phase 1 trial was started, those 4 young people at the bottom left, Dr. Corbett holding the model of the spike protein in the middle with her young students who were what we call post-backs. They had graduated from college, getting ready to go to the next phase. Those are the 4 people who really did a lot of the hands-on bench laboratory work that helped launch that Moderna vaccine and got it into the clinic so quickly.
So these little 4 hidden figures are the ones who did all the work
These
that
are
got
the
us to
hidden
the point.
figures who did that work.
These 4 hidden figures.
Not many people know that. A lot of people know Dr. Corbett because she is very good on social media. She is well recognized. She's been part of the face of the whole vaccine development, and she's now an assistant professor at T.H. Chan School of Public Health at Harvard. The other 3 are now the tall guy, Jeffrey Hutchinson, is a grad student at University of Washington. Cynthia Zawawo next to him is a medical student at Indiana, and Olu Abiona on your far left is a MD PhD student at Case Western Reserve. So those other 3 students working with Dr. Corbett did a lot of that primary hands-on work to get that vaccine launched, the first trial, the first product into phase 1 testing, and one of the first vaccines that was authorized for use in November of 2020 to get us started on vaccination.
So definitely diversity of the healthcare workforce and the biomedical science workforce actually may make a difference, huh?
I think people need to recognize the talent that's out there.
Now, I go back to this slide here because, guys, this is a slide that looks at the initial COVID-19 vaccination protocol as of March 23rd, 2023. And Dr. Graham, tell us what the slide is showing, and then I want to ask Dr. Satcher a question. What do you notice that's obvious in that slide?
This is a relatively recent slide. This is current data. And what you notice is different shades of green. And I just want to point out 2 major things to notice. And one is that the lightest shades of green in this graph is the African continent, which means it is very under-vaccinated. And even at the end of 2021, less than 5% of people in Africa had received the vaccine. Now, everybody is aware now that we have waves of variants of viruses that have come through, making our current vaccines less effective than they used to be. But That's because viruses don't observe boundaries or borders. Global health is, personal health requires global health, and without really solving this problem and preventing things everywhere, we're not going to be safe. Now, the second major point is that, so that's a problem of access to technology, access to training, access to products. The other point is that the U.S. is a lot lighter shade of green than Canada, China, Australia, South America. That means that there's about 30% of people in the United States who had access to vaccination and elected not to use it, elected not to take the help to give them immunity prior to infection that could help save their lives. So a lot of lives were lost because of misinformation, distrust, all the other reasons for vaccine hesitancy. And so this is a problem of uptake. And so access and uptake are the two things I want to spend the rest of my career time on. And I chose to go to Morehouse School of Medicine because equity is in their mission statement. This is where I think a lot of the obvious work that's needed needs to happen, and Morehouse is the perfect place for me to try to do that work.
Thank you, thank you. Now, Dr. Satcher, Dr. Graham talked about misinformation, vaccine hesitancy, and we can see on this slide the results of what happens when that occurs, and when you don't have access, when you don't have, like low-income resource countries don't have access to manufacturing, et cetera. How do we, as Rotarians, make a difference in these spaces where we think we may not have influence? And you might want to tell some of the information of how Rotarians help with smallpox, or Rotarians help with polio.
I'll start with polio because when I was director of the CDC and we were trying to eradicate polio and made a lot of progress in Africa and in India. And I remember going to India because the plan had been that in 1 week we would immunize 1 million children a day. And what happened, of course, was, in addition to being successful, the Rotarians in India were out in the villages getting kids to come to get their immunization. They saw it as a part of their responsibility. I don't think we have that attitude in this country yet in terms of our responsibility for each other. But it was true in this effort to eliminate polio in India, a fairly successful effort. But there are a lot of other examples. But Bill Foege is a name that many of you know, right? Bill Foege was former director of the CDC, and most people give Bill credit for leading the way in terms of the eradication of smallpox and the near eradication of polio. The difference is the World Health Organization was really viewed as the leader, and we were all a part of that effort on a worldwide basis. It is that kind of attitude that's going to be most productive, I think, when it comes to eradicating diseases in the world. We've got to see ourselves as a part of the World Health Organization, worldwide effort to make people healthy. And I think that was true in this instance.
And Rotarians played a big role in it.
Rotarians, I believe one day 56% of Rotarians in India were out getting children to come and get their vaccines. It was a really, now I didn't know the Rotarians personally, but I know that they organized, they probably had less to work with by far than we do, and yet we were successful because of the Rotarians in India.
And so, Dr. Graham, we have another, I think, virus that we sort of have just thought we had to live with. And recently, a couple of weeks ago, we saw the FDA approve the RS vaccine, and that was really the start of the core of your work. How is that RSV vaccine being seen, and what would you like to see happen with it, and how perhaps can Rotarians help with dissemination of information?
Yeah, respiratory syncytial virus, RSV, is something that causes a lot of excess mortality in the elderly, but it's even better known for causing a lot of disease in young children. So especially children in the first 6 months of life can get severe disease. About 2 to 3% of our children born end up in the hospital the first year of life. That's almost all due to RSV, and it's one of the causes or precipitants of childhood asthma and wheezing. The first vaccine for RSV was approved on May 3rd, and there was just a successful vote for the advisory committee on a maternal vaccine that would help protect young infants for RSV just last Thursday. And so Rotarians started the polio eradication, catalyzed that whole thing back in 1979. Mm-hmm. That was about 20 years after the polio vaccination process started. There's an opportunity right now to be on the very front end at the very beginning of a new eradication of RSV program. And I don't know if Rotary's interested in that, but it's consistent with your prior missions and involvement in polio and smallpox, eradicating RSV and improving overall lung health in our young children around the world. And so I just want to make you aware that there is an RSV vaccine out there. It's coming along. There's going to be more products approved over the next 6 months or so, and I see it as a new opportunity. It doesn't really have a grassroots organization behind it like polio did with March of Dimes and Rotary and things like that. So RSVs, to me, is a big opportunity for Rotary, and these products, unfortunately, I think are initially going to be seen only in high-income countries.
That's right.
And as we've learned from all these other diseases, including COVID, it's in high-income countries' best interest to solve regional problems and problems in low and middle-income countries to create better overall global health that then ends up improving our high-income country health. So should be aware of the RSV vaccine efforts coming along.
And the criteria for adults is over the age of 60. Is that correct?
There is now an approved vaccine for adults over the age of 60.
Now, I know some of you all died here and all may not know that you're eligible, but we are eligible for the RSV vaccine, and RSV complications as you're aging, young people and aging, it can be challenging. So we definitely encourage people. And we definitely encourage Rotarians to think about ways in which we can really help to add to the opportunity to disseminate good information and to be champions of things that really will impact us worldwide. And so I want to bring up one other thing as we come to a close. These are issues that we have the opportunity to continue to discuss, not just in Atlanta, not just in the state, but worldwide. And we've had the fortune of having people like Dr. Satcher and Dr. Graham. Satcher's been here with us long-standing. Dr. Graham is new to this community, but we are going to host the David Satcher Global Health Equity Summit. And this will be an opportunity to pull many together from our global health community, the work that we are doing in our global health community, to really raise awareness of the opportunities that we, not just as Atlantans and Georgians, but as Rotarians, can get great information out about the value proposition of vaccines. We have the chief architect of health equity, and we have the chief architect of vaccines in this city, and we should not let these resources go underutilized. So thank you all for joining with me today for this short conversation, and we'll be happy to take any questions.
So one of the first things that I wanted to ask, and I know Tommy Holder, who is chair of the board of Children's Healthcare of Atlanta, is with us today too, but we have seen a marked increase in the severity of illness in our children, and the reemergence of some severe disease that had been mitigated in the past with vaccine. But we are seeing now a growing population of parents who are not vaccinating their children. And I'm curious if in the work that you do, you know what some of the reasons for that. Is it because they're worried about the myth of autism? Is it because it's distrust of the medical profession? I mean, what do we need to be messaging out to help parents understand the importance of vaccines for their children?
I think it's some of all of the above. I think it's sort of like some of all of the above. Distrust is a major issue when it comes to getting parents to make sure that their children are immunized. So people have to believe that the system is working for them and not against them. I think we've made some progress in that regard, but we still are not there. But I do think distrust is a part of it. Lack of information is a part of it. So we have a lot of work to do, but it's work that we can do to get people to trust more in the validity and the value of vaccines.
Is there anything?
In part, vaccines are their own worst enemy because they've been so effective that people have forgotten how awful diphtheria and whooping cough and measles and all these other diseases that used to kill about half of our children before they had a chance to grow up, and now are so rare that people don't realize what a threat they are. And so part of the problem is just helping people to have enough knowledge about how bad some of these diseases can be without vaccination. And one of the problems with coronavirus pandemics or other things where normal life is disrupted is that people fail to have normal routine medical care. So we have a lot of under-vaccinated children right now. And it's even worse in places like West Africa that was disrupted by Ebola and other places that have been disrupted by other events around the world. So yeah, vaccines are in part their own worst enemy because people forgot about how bad things used to be.
And Stephanie, I think that we learned something from COVID. The messenger matters. Who is carrying the message of the benefit and the why? And how are we engaging the community and understanding what's the source of all of their concerns? And not dismissing their concerns, addressing their concerns, and just like we do in science, when we don't know, we actually say we don't know. And we actually have the fortitude to figure out the answer. And so saying that to the public when we don't know, but then giving them the risk benefit of the opportunities, and then going along with them through the journey. And actually believing and taking into consideration that their fears are real. And that's what we saw with COVID-19. That's why we were able to remove some of the hesitancy, because we had the right messengers and we had the right message. And those messengers and the message were reflective and culturally appropriate for the communities that we were trying to connect with.
Are there questions from the audience? Yes.
On your map of vaccinated countries, how can England be a country where there's no information available?
It probably.
I don't think I have a good answer for that. I don't have a good answer.
Our British Consul General can...
You know,
98% for
people
over
over
70.
70.
For over 70, I do think it gets lower, but we're definitely in the darker green area. I didn't want to show off, yes.
Yeah, right, okay, yes.
2 questions here, yes. We'll go. Oh, Bill,
Dr. Satcher,
then
you were
Julius.
in the audience in 2012 at Georgia Tech when we bestowed the Alvin Allen Prize for Social Courage upon our friend Bill Baker. And it's generally accepted that he's the man who got Bill Gates and Jimmy Carter involved in global health. What would have happened in COVID if those two organizations weren't in the game?
I don't know, and I hope I never will. Bill Foege is a person of great integrity, of course, and courage, and that's not just in this country, but all over the world. People in public health who have worked with Bill have come away believing that this is somebody who, number one, knows what he's talking about and can be trusted. And I know that Bill is not well now, so I'm saying this with the understanding that he has done a great job when it comes to public health. But my favorite definition of public health is that it is the collective efforts of a society to create the conditions in which people can be healthy. Create the conditions. And that's what public health is about. And so each one of us has a responsibility to help create those conditions in our communities, in our state, etc. But we still have a ways to go.
Julius.
2 points. Mutations occur in viruses, and this virus, the COVID-19
Can-
virus,
can-
is undergoing a mutation.
Can I get you to come up here and use the mic?
I recognize that person as Julius Cole. We were classmates at Morehouse.
You can see he was more successful than I was. Well, we know that viruses undergo mutations, and the question is, have we declared the end to the COVID-19 virus too soon, and in terms of the recurring mutations that may undertake, and we might have a resurgence, is the first question. The second deals with this whole question of people telling the story. And one of the storytellers is Dr. Fauci. And today, his telling the story has ended up with him having constant bodyguards to protect his life and family. So the question is, how do you get politics out of science?
I don't know who wants to answer that one.
You want to?
Well, we expect viruses to mutate. They always select for themselves that are better transmitted and things like that. And so one of the solutions for combating that is to be able to immunize the whole world in 6 months instead of taking 6 years. If we can't immunize the whole world in 6 months, we can't really get ahead of those variant waves that are going to come. So to me, figuring out the global coordination and cooperation and the technical things that have to happen in order to do that is part of solving the vaccine access problem. And for me, it's along with your other question earlier that to me, one of the best ways of addressing that is to diversify the global health workforce, both in science and public health. And that diversification helps reach more audiences and more populations, and it helps improve trust and expertise in institutions. And so diversification of the public health workforce and the scientific workforce, I think, is one of the first steps toward getting to that place where you can start rebuilding trust in science. And it has to be done during peacetime. You cannot rapidly gain trust during a crisis. It just doesn't work that way. So people like me, I guess, have to speak up a little bit more during peacetime and try to help people understand the value of immunity, the biological basis for immunity, and try to have a better understanding of things so they don't get misdirected so easily by the social media things that are going on out there.
Dennis, you had a question.
Yes, and I brought my own mic, so I'll speak up. You mentioned that we have a problem with not a unified, strong, global approach to public health. I've heard that we have that same problem here on the national level, that we don't have a strong, unified approach nationally. We have a lot of fiefdoms out there. So specifically in terms of the U.S., how do you think we should be moving there?
Well, the temptation is to say that government should stay out of public health, but that wouldn't make sense either. It's a difficult question. I think trying to get people to work together across, governmental lines, across national lines is critical. And we've made progress and then we've gone back in some cases. I believe that in 1978, when the last case of smallpox was seen, I believe that we were moving in the right direction. But I think in some ways we've moved backwards since then. And of course, COVID-19 is an example of that, moving backwards and not working together. So, but I believe what we have to do is to see this as a global problem and approach it that way.
I will give this example. This weekend, we had the CMS Administrator, Chiquita Brooks LaSure, as our commencement speaker, and she appeared with me on our Danforth Dialogues. And she was part of the team who worked on getting the Affordable Care Act approved. And she gave the example of Nancy Pelosi and how Nancy Pelosi was focused on the outcome. And the outcome was to get the Affordable Care Act approved so that we could increase access to care. And she was willing to do whatever it took, whatever conversation needed to be had across the aisle, meeting people where they were, asking questions, answering their questions, but keeping her eye on the prize. And I think that's what we have to do, is put the background noise in the background and keep focused on what the outcome is. And the prize for us is the continued ability for us to navigate throughout the world without borders and without concern about one area being disadvantaged or advantaged than another. And in order for us to accomplish that, we got to bring everyone as often as possible to the table to address their concerns, listen to their perspective, and add that to the solution pool, keeping our eye on the prize and getting rid of the background noise. And that needs to happen first in our nation, and then we need to use the proudness of us as a national power to disseminate that to other parts of the world. Low-income resource country must be able to make their own vaccines. They should not have to depend on our benevolence or whether we feel that we should be able to give it to them or not. We need to empower them to be able to make their own vaccines, and that will ensure that when the next pandemic occurs, which it will, that they are equally prepared to take care of themselves first, using their cultural competence in their community to eliminate that vaccine hesitancy and ensure a greater uptake. Thank you.
Our last question will go to David Lewis.
Misinformation and disinformation are presumably one of the reasons why the U.S. is a lighter shade than its neighbors. I'm wondering, out of all the misinformation that we saw being spread on cable news or politicians talking about hexachloroquine or the summer's going to cure everything, if there was a particular moment when you groaned and thought, oh my God, I'm just wondering, what were the worst moments for both of you in that spread of bad information?
Well, to be honest, we were pretty intensely focused on just moving forward and avoiding all the noise that was going on around us. And to kind of get back to what we were answering a minute ago, these decisions about biology have to be done, we have to depoliticize biology. Biology is biology, and you cannot change it by a belief system. It's biology. And somehow, biology underlying our health has to be looked at as a long-term, non-political, nonpartisan issue that has to be looked at as beyond an election cycle decision-making process. This is a long-term thing that all of us have to care about, in a 40-year plan, not in a 2-year plan. And some progress has been made, I think, since Ebola. Ebola was a lot less organized than Zika, and Zika leadership group process is what formed the basis for the coronavirus Operation Warp Speed organizational process that came up and helped advance things quickly. The World Health Organization was defunded to a large extent back in the economic crisis in 2008. That was an extremely short-sighted consequence of the global economic crisis. You defund a public health organization in 2008, and it's still trying to catch up to where it was even back then. And so these decisions on things like global health have to, be above politics somehow. And to me, that is, I'm not a politician, but somehow many of the people, leaders in this room, probably understand how to achieve that better than I do.
Well, please join me in thanking our very esteemed panel. Lots of messages to take, and I'm sure that Morehouse School of Medicine has information on their website. I know Children's Healthcare of Atlanta has information on their website regarding vaccines and the correct information for those of you who are interested. As a reminder, next Monday is a holiday, so we will not be here. I wish you all a very happy vacation weekend, and we will see you in June.